Hi, I'm Matt Thornton. I'm the clinical director at Specsavers in Bolton. We have recently launched a GERS scheme.
GERS stands for Glaucoma Enhanced Referral Service. It is a service that uses optometry to reduce the number of glaucoma referrals going into secondary care, bringing down the wait lists.
When we launched the scheme, the average waiting time for a glaucoma appointment was somewhere in the region of 70 to 72 weeks. Since the scheme's been launched, because there's been a reduction of roughly 50% of referrals due to the people going through the scheme, now the waiting list is somewhere in the 30-week mark, so it's actually halved the waiting time, which is great. The hospital are really happy with the scheme because they're able to see the patients that need to be seen, and the patients, of course, much prefer not to have to wait for weeks and weeks on end.
Here's how the scheme works. A patient is seen in community practice and the optometrist suspects glaucoma. Previously, the optometrist would look to refer them to secondary care. Now, instead of going straight to secondary care, they get e-referred to an accredited optometrist who has the professional certificate in glaucoma in one of the 4 accredited practices in the Bolton area, where they will be seen within 4 weeks. The patient does get to pick which of those practices they would like to be seen by. There, they receive a dilated fundus examination, photography, OCT, full threshold fields, and angle examination by Van Herrick, in an appointment that lasts about an hour and a half. That optometrist then determines whether to send the patient on to secondary care or to send them back to the referring optometrist for continued monitoring. If the GERS practitioner is unsure, they can refer them down to be seen again in another year.
In terms of experience rating, so far, everyone who's gone through the service has scored, so 95% has scored the service at 5, 6 or 7 out of 7. 75% scored it 7 out of 7. So, it's been quite a popular service from a patient point of view. No one scored it less than 5. And that's out of a cohort of 380 odd patients. So it's been quite a well-received service from the patients. One of the main issues, obviously, at the moment in the NHS is significant waiting lists right across in all disciplines. But since the pandemic, there's been a significant increase, particularly in the waiting list for glaucoma and other ophthalmological conditions. And there is a shortage, as we know, of medical practitioners able to deliver the services in secondary care. Whilst on the high street, we have lots of optometrists working who have skills from the degree that they can use to help better provide this intermediate care before they get into secondary care. This is the first, well, it's the second step in optometry taking a greater playing a greater part in glaucoma care. So this is in effect reducing the amount of appointments going into the hospital. But even then, there's still a 30-odd week wait to be seen. The number of people with glaucoma is only going to increase over the next 10, 15, 20 years as the population ages. As diagnostic techniques improve and glaucoma diagnosis becomes more accurate, unfortunately, there'll be more people being diagnosed with glaucoma, but there's more people to look after. So it's important, I think, that optometry doesn't stop here. I think it's important that optometrists look to gain further qualifications and perhaps extend to the higher level certificates so that they can start to play a part in glaucoma management down the line.